What up? What up? What up? Hello to the Miss Village. I like this. Reach out, talk to y'all again. We've been getting a bunch of questions after the last Corona update, so I figured I'd do another short one, see if there was anything else that I can answer. As you can see, I am also wearing buttons again to belay the seriousness of this. Do have sleeves and, kicking it up a notch, glasses. So, what's up to the first couple people that are here? The truth is, since the last Corona update, there hasn't really been too many developments that are scientifically based, okay? It kind of comes down to what we said before. You will do well through this crisis if you do two things: be calm and be clean, okay? So the most important thing that we can do now is actually just to sort of stay away from people to a certain extent. If we keep our social distance, right, we will stop infecting new people who will stop infecting new people, and we can get ahead of this, okay? That's as simple as it is. To use simple numbers, let's say that the virus has a 10-day lifespan in any given human being. If you infect someone on day 9 and then they infect someone on day 9, right, then suddenly that's a month-long issue rather than what would have been, a 10-day long issue. So I'm trying to, those are just sort of generic numbers that I'm throwing out. That's not how COVID is actually working, but I just wanted to be clear. Please stay apart. Like, it really, really does matter. If you have any doctors or nurses in your family, you've probably seen pleas from them on Facebook. We are running out of everything. Doctors are having to sign out a mask at the beginning of their shift and sign that mask back in, potentially, to be cleaned and reused, which is a crazy thing for us to have to do. But I just sort of wanted to answer any questions that you guys might have and to, again, reiterate some of the things that we talked about. So, 1, wash your hands, right? Be clean, right? Try not to react and go crazy, okay? Despite all of the scariness that I know that you guys are out there, we will get through this, okay? Keep your distance from other human beings. Please just stay home. I know it may drive you crazy. Let's see. John Bryant says his teenage son never cleans his room. If you fart on his pillow, can you give him pink eye? You absolutely can. I'd be more worried about him giving you pink eye since he probably has a laptop, but it's just to be clear. One good idea is that if your kid's really gross, you can hide some old meat under somewhere in their room and say, oh, this smells, and they keep having to clean it because they just can't live with it anymore. I've heard that works really, really well. All right. So Daniel Myers stopped listening to Alliances to tune in. And Nick says will give me $100 for the draft that I have so far. All right. So Chad's asking a question. How long does the virus survive on hard surfaces? So I'm sure you guys have Googled this. You see things going on and on. Basically what we're looking at is that, 3 to 4 days in certain laboratory settings, we've seen that the virus can remain on certain surfaces, right? Obviously, that changes if it's in sunlight. Sunlight often, kills most viruses. It changes if it's a wet or damp kind of environment. That will promote fungal growth and other things. We can't say how the virus is going to be. But basically, if you're worried about a surface, clean the surface, right? And if you're staying at home and quarantining, just try to be aware of what about. Sorry, my phone rang. So that's what's going on. All right, somebody else asked me, when will herd immunity kick in? So I'll leave it on because it's very doctory. So herd immunity, right, just to use colloquial terms, is basically that if, let's say you have a population of 100 people, right, if a certain amount of them, let's say 90%, are immunized against a disease, right, then the 10% that decide not to get immunized, okay, will most likely be safe because the disease it's a 9 out of 10 chance that it'll affect someone else, and even if it affects them, they won't give it to someone else. Herd immunity is one of those things that has come up with the anti-vaxxer kind of movement, which we're not really going to dive too deep into. But the point is, we have no vaccine for the coronavirus, and we have no cure for the coronavirus. So the only thing that was keeping the coronavirus from flaring even more out of control, right, is the fact that we are observing social distance, is that basically we're not interacting so that sick people can't infect healthy people. There's no scientific thing that they're doing to help us. The thing that's helping us is literally washing hands, being calm, and staying away from each other. Okay? So it's the kind of thing where I know that people are saying, oh, well, this will be over in a week, or this will be over in 2. It's hard to navigate what's going on in the news, obviously, because there's biases and everyone has their own agenda. But what I encourage you to do is look at scientists, look at PhDs that work with the CDC, look at physicians and see what they are saying and what science is backing that, okay? So rather than going by what, a celebrity says or what a politician says or what anything, go by the actual science. And the only thing that is helping us right now is the things that you guys are doing. You are staying away from other people. So, it can't jump, the corona cannot jump through walls or anything like that. So as long as you're staying away from other people, as long as you are cleaning your hands, right, then you are helping keep it down, okay? When people go to spring break and make out and act like, well, the dumb kids that they are, and then go back everywhere across the country, that's the opposite of what we should be doing, okay? There was a story in CNN today about 40 kids that decided to have a party, and one of them tested positive for the coronavirus afterwards. So that's now 40 new families that have been exposed, and hopefully, right, nothing happened with the other 40, but we don't know, okay? And that's a risk for 40 families or whoever they're going back to, okay? All right, so let me answer some of these questions. So Ashish Sharma is saying, can people who are recovered get infected again? That's a very good question. Now, the way the human body works, or like the way they say that you don't get the same thing twice, right, is that when you first get infected, your body's got, let's say, like 1,000 different, cells that will try to stop infections, okay? And when the infection first comes in, each one of those try. And let's say that 1 out of the 1,000 can kill that particular virus or infection, okay? It takes a certain amount of time for your body to try all the different ones, but when it finds the right guy, it says, yes, we need more of this guy. And they make more of that one particular cell. So if you get exposed to that virus again, as opposed to having to try 1 out of every 1,000, your body has already made 500 of those, right? So it will be able to react much faster and much more efficiently to a virus that it was already exposed to. Okay? Does that make sense? Now, and that's why we say you can't get the same thing twice. It's actually not, it's a misnomer, because you obviously can be exposed to the same virus twice, but the way your body reacts will be much stronger in a normal situation where there's not other underlying factors. So if you get corona, can you get it again? You can definitely be exposed again, depending on the state of your immune system and the state of, your underlying health. And if you have any other health issues, you may have a stronger ability to fight it off again. And a lot of times people that are younger, and again, I'm using the medical terms, so like people that are, under the age of 50, right? They might get it and not even notice. They can be totally asymptomatic. They might get it and feel like they had a cold. They might get it and feel like they had a mild pneumonia where, they could still take medicines at home. I can't say, because the truth is, the difference between Western medicine, which is what we use, and Eastern medicine is that Western medicine is basically just based on scientific trials, okay? So let's say that we test 100 people. We know that 99 of them will behave the way we're saying, but there's always going to be a random person over here that is younger and unfortunately dies from the virus, or or the vaccine doesn't necessarily work, right? We're using best guess and best reasoning, but no one can say for 100% certainty anything in life, and that applies to medicine as well. Let me see if I can answer any of these other questions, and let me take a sip of water. Okay, so as I look to see, all right, so let's see, So Dustin says he can't stay home because of work. And that is something that I'm sure a lot of you guys are having to deal with. Not everyone can work remotely. There are heroes out in our society, like the nurses, like our garbage men, like, people that handle power and put it back in, that are necessary parts of our society that can't stay home. And I think that they all deserve our praise and applause. But if you have to go out, just do the best that you can, man. I mean, Dustin, I'm looking at your picture. You're a young guy. Just wash your hands if you can, okay? Don't huddle together with other people at lunch, It's fine if they're a little bit away. You can talk to them, but just try to observe social distancing. Try to observe like a 6-foot bubble around you as much as you can. And if you can't, then afterwards, wash your hands. Do it the right way, every surface. And, then you will have the best possible outcome that can be, man. And I hope that you stay safe. All right. So Keith is saying, is it true that I gave up working in the hospital to write full-time? So recently, yes, I have. I am doing the full-time writing gig now. I am still liaisoning with the hospital and still talk to my physician friends every day. And I talk to a bunch of them around the country to get sort of the latest things before I talk to you guys today. But yes, now I'm going to pursue it full time. And Lauren says that most viruses are vampires. I think that that's an excellent story you should write. Hello to the Alvarados as always. Let's see. Yes, and Doctory is a great one. So Mark Madden says, one of the crew physicians in Japan, it was on the surface for 7 to 10 days after evacuation. And so, I mean, that's what I'm saying. Anytime that we say a fact, right, what we're saying is that based on all of the information that we have and based on the reasoning of experts in the field, this is the best information that we can give you. Now, that does not mean that you should discount it, because no one can ever say something 1,000% for sure, because there is a lot of horrible misinformation coming out. Okay. One of the things that I wanted to talk to was the number one story on CNN and BBC and New York Times today about the hydroxychloroquine. Listen to what I am saying, okay? There is a potential for many different medications to potentially have a positive impact, okay? But medications should not be used lightly. And medications, especially medications like hydroxychloroquine, have a long list of side effects and can cause serious issues like heart attacks, like decreasing all of the white blood cells in your body, like having a skin rash that covers 95% of you, right? Now, this doesn't happen all the time, but it is a potential, okay? And so what I'm saying is that when I talked about the two things we need to do, stay clean and stay calm, this is part of the stay calm. We all feel better when we are able to do something, okay? But doing something without the right information can often be more detrimental than just sort of letting things develop and gaining more information, okay? Now, like I said, Western medicine is based on science and is based on tests. So before we can say that hydroxychloroquine is something that is going to work, we have to test it on people that have it. And we can't just say, okay, well, we gave it to this one guy and he got better, because he might have gotten better anyway. And we can't just give it to one guy and say, oh, he got worse, because he might have gotten worse anyway, right? And we can never know that from one patient. We can't know that from 10 patients, right? Ideally, we have to use, and that's what we're doing now. We're using, for this batch of patients, this therapy. And for this batch of patients, this therapy. And for this batch of patients, this therapy. And basically what we're going to look at is that, okay, well, for this batch of patients, we found that more of them get better. And ideally, they don't have enough side effects to make this therapy not good. Okay? I mean, there's a lot of like technical things that I could get into, but the main point is not to react to the first thing that we hear. There's a horrible story about how this elderly couple took hydroxychloroquine that they bought for their fish tank, and because they thought it was the same thing. It's not the same thing. The only difference between poison and medicine is the dosage that you're taking. So we really do have to wait, unfortunately, and I know that's an uncomfortable thought, for the experts to do tests, to give us reliable information, not sensationalist information, not something that someone's jumping on to make us feel better, but actual real scientific facts before we move forward. Okay. Let me see if there's any other questions that I can answer. John says, is getting the flu better than killing your roommate? Well, it's certainly better than killing your roommate now that we have a paper trail on you, buddy. So that's it. Hello to Taylor Spencer. All right, so Jessica's saying, what do we think about the use of plasma from recovered patients on sick ones, COVID? All right, so the theory there is, right, just what I talked about before, that when you're first exposed to an infection, right, your body is scrambling with everything that it has to try to see what can kill the infection. After it kills that first round of infection, your body is smart enough to make more of that just in general, right? So the thought process is that if we use the plasma, which has antibodies, so in the blood that we get out of our veins looks red, but if you put it in a centrifuge and spin it, it comes out in various layers. And one of the layers is a clear layer that we call plasma, and a bunch of the other stuff sinks to the bottom, like the red blood cells. And in the plasma are the antibodies, okay? So this is one of those things where if this was just a plug and play, then that would make absolute sense. But unfortunately, the human body is a lot more complicated than that. So we don't know if putting the just plasma in someone else, right, will be a good thing. We don't know if, there's a high enough concentration of the antibodies that are coming out. We don't know about the cross-reactivity of various blood going into someone else and what that's going to happen. We don't know that maybe this does work, but it only causes such a small reaction that it's not worth the time and energy that we're putting into it. Just like the hydroxychloroquine and the azithromycin and everything else that I've talked about, okay, we're not going to know until we try it on a significant number of patients and we compare those to patients that are getting a different therapy or no therapy at all. Then we will be able to say relatively reliably that based on these 1,000 patients that we have treated, they have a 50% chance better to have a resolution and not get a negative outcome after getting coronavirus. But we won't know until we actually do the science. And sadly, again, I know that all of this is scary, but the best thing that you guys can do is the same advice that you would give to somebody looking up to you. Be calm and let's operate with the actual facts that we get, not the sensationalist stuff that people are telling us to either make a quick buck or to make themselves look better. Okay. So Chad's asking, so the antibiotics that they are prescribing are treating secondary symptoms. So again, yes, there is no cure for COVID at this point, right? It is a virus. Antibiotics work on bacteria. They do not work on viruses. There is no vaccine. And again, the difference is that a vaccine will keep you from getting it initially. A cure will fix you after you get it, just in case anybody was confused. So yes, what the hospital can do is that if you get the coronavirus and if you get to a point where you just can't last at home, and I don't mean that you feel like crummy and achy. We all feel like that sometimes. I mean, you need oxygen in your nose to have your cells in your body live long enough. You are having such a bad temperature that you are, you are in danger being at home. That because you have this respiratory illness, maybe you get a secondary pneumonia, meaning that two things are happening. That the coronavirus sort of knocked you down to a certain extent and it made it easier for you to develop some other kind of thing, right? We can deal with, in medicine, supportive care and dealing with the symptoms that you're getting from the coronavirus until your body is strong enough to fight it off on its own, right? That's who should be going to the hospital. People that literally just cannot live at home, okay? But there's not really another reason to go, because even if they diagnosed you with the coronavirus, again, if you are healthy enough to be at home, there is no cure, there is no vaccine. Okay? All right. Let's see. So Eric Curran is asking me, what about all of us who are told to stay home, but our jobs decided they are randomly essential and forcing us to go to work? So unfortunately, Eric, it depends on how good of a company you work for, right? There's a guy in New York who runs a pizza shop who took out a $50,000 loan just to support his employees and make sure they have enough food at home. He is around them. It is great, okay? There are other people that are just money hungry and view you as a number on a file, and they couldn't care less about you. I don't know who you're working for. I don't know what that is like. All I am saying is that, unfortunately, as in our adult lives, we have to make the difficult decision about like how much you are being exposed, how much you need this job. Are you able to, find a way to finagle it? In an ideal world, right, everyone would stay home, but we can't operate in a society like that. We need our doctors. We need our police. We need our nurses. We need our garbage men. We need people that are going to do it. Now, personally, this may be sacrilegious to you guys. GameStop tried to say that they were an essential service. Not so much agreeing with that one. But hey, it just sort of comes up with whatever the specifics are for your case. All right, so David Lutke asked me, with COPD, since it causes shortness of breath and a cough, what are the things that you should look for if you have COVID? All right, so David is telling us that he has a underlying respiratory illness, right? Which does make you in a much higher risk group, right, than someone that does not have an another underlying illness or a respiratory issue. What you would look for, David, is the same things that you would look for in a COPD exacerbation about whether or not you have to go to the hospital, right? If you are having a compromise to your vitals, and the reason that doctors call them vitals is that they are vital. They are most important. Your vitals are going to be your heart rate, your blood pressure that you can check at home if you have a cuff, right? How fast you're breathing, okay? Most people breathe under 20 breaths a minute. If you are, and it just won't stop, you need to go to the hospital. Now, if you're doing it because you're panicking, woosa, okay? But that's not what David is talking about because he has a respiratory issue, okay? Now, it's winter. If you have a cough, we all get coughs in the winter, okay? If you have a sneeze, if you look outside my house, it is yellow. Georgia pollen is gross, okay? Not everyone that gets sick has the coronavirus. You do not necessarily need to go to the hospital, and we need to be aware that our hospital people are working themselves ragged trying to keep ahead of it, and we need to help them, okay? But again, David, you have to use your best judgment. If your vitals are compromised, right? If you have a rip-roaring temperature that just won't go down, that you can't control with aspirin or Tylenol, if you cannot breathe, if you are turning blue, if you can check your blood pressure and it's insanely high, right? Or very low, and that's not normal for you, right? Or if your pulse is racing, you need to talk to a doctor. Okay. So Sharon is asking, can you tell me how dangerous it is for you to drive your grandma to dialysis twice a week? She has no other options. So this is one of the things that I talked about before. We need to observe social distancing, but at the same time, we're still part of families and we're still part of a cohesive society. If you know someone that is old and elderly, right, we need to check on them. Not physically go over there if we can avoid it. Call them, check on them, okay? And one of the things that we need to do is, like, let's say that they need their prescriptions picked up. We go pick those up for them. Because if we go to the CVS and get exposed to something, our younger bodies can fight it off. An elderly person, it might be the end of them. Now, Sharon's asking about dialysis. Dialysis is absolutely necessary. You can die if you don't have it after a week, less, depending on what we're talking about. So your grandma has to get to dialysis. Now, when you go there, you can ask them if they have any other options, if they have a shuttle bus that drives around and picks people up and drops them off, if there's other things that you can do. It's great that she has your support, though, but dialysis is not something that she can miss. So Dean says there's a strange woman in his house before that he's never noticed, and he thinks his name is wife. So that reminds me of a hilarious thing that I saw. There's this guy listening, and there's like a gravelly voice, and it goes, "Hello, you've been exposed to the coronavirus. You have two options for your quarantine, however. A, you can be with your wife and children. And B," and he goes, B? Yeah, what's B? Anyway, good luck with the wife. I hope she's not reading this. She'll kill you in your sleep. Okay. Kirk says, loves Dr. Kong. Corona drinking game. Every time Dr. Kong says, okay. Do I say okay a lot? Okay. Maybe, whatever. Thank you. Thank you. All right. So Heather says the virus is declining in China. What is causing this decline, and what will it take for it to decline here? Okay, so the virus started in China in September. That was the first news reports we had, and it was in a certain area, right? China is saying that because of their isolation and because of the measures that they've taken, that they haven't gotten any new cases. So there's 2 or 3 things I want to say about that. One, it's possible China isn't getting any more primary cases, meaning that their population isn't popping up with anything else. That's possible. That requires that we believe what China is saying, which I'm not saying that we believe it or not, but I am saying that there's obviously a motivation to say that everything is done, and we have to really look at that, okay? The second thing is that we know that China is getting secondary cases. Chinese citizens that were in other parts of the world that are now going back to China, some of them are testing positive for the coronavirus, right? This is one of those things where we're looking for, well, it worked for them, what can we do? Again, the things that we can do are very simple. We do not have a cure or a vaccine for this. They are working on it. God, willing, we get that tomorrow. But it's entirely possible that we will not get it for many months because that's how science works. It requires hard work. What we can do is wash our hands. Stay away from other people, okay? Except for your immediate sphere. If you are not getting with other people, right? If everyone that was sick right now did not expose someone new who was not sick, this would be over in a matter of a week to 2 weeks. Simply put, without a medicine, without anything else, if the people that were sick stayed away from everyone else, right, then the virus would run its course. It won't live in us forever. That's not how this works. That's not how anything like this works, okay? But we're not doing that. Last week, there were tens of thousands of kids at spring break. There are still politicians that do not believe in social distancing and call other people sissies for it. We have just shut down Atlanta yesterday. Okay? Think about how long this has been going on, and we just got shut down yesterday. There are other major cities that are not shut down, okay? We are not following the directives of our most educated scientists, and we are not following the directives of our doctors. And if we did that, that's what would help us. Okay. So Vicky's saying they do not know if we can become reinfected. Yeah, and so that's what I was saying. At this point, we just don't know, but we'll see. So Chris is asking if I've already talked about ibuprofen. Okay, so ibuprofen, right? Advil, ibuprofen, they're basically the same. Motrin, they're all basically the same thing. Okay? They can reduce temperatures. Okay? If you have a fever, they can reduce aches and pains. You cannot take them a bunch because they will destroy the lining of your stomach and cause ulcers, and they will destroy your kidneys, and that's a much bigger issue, okay? So just like everything else, do not take it because you think it's protective. I don't care what you've heard. For God's sake, do not swallow silver. That is a metal. That is not something that we want to do, okay? But in short dosages, like you've done your whole life, right? You can take ibuprofen, and it is a very good drug. All right, so John is saying, serious question, I was reading about mutations. How are we expecting them to play a part? Okay, so this is a very logical question because we all live in the age of Netflix and movies. For the most part, stuff just doesn't mutate that quickly. Now, this is a different case, right? Because mutations are removing all the science fiction. What a mutation is that the virus has its own life cycle. It replicates, right? Every time something replicates, every time something new is born, right, there's a potential that it's not created correctly. Most of the times when this happens in nature, right, then the offspring dies because it wasn't made correctly. But every once in a while, right, it doesn't die and it develops new characteristics. I have never seen anything in my medical career or heard about really anything in the recent past, right, in the last decade or two, that has really mutated. The things that we think about before is like Ebola versus Ebola Zaire, and that's what everyone's afraid of, obviously. We don't, as far as I know, we don't know if that happened during the scare or just that there were two different strains, or it is a very logical question to worry about it. But all we can do is go by the information that we have. Now, the less of us that get affected, right, the less virus there's going to be in the world, the less life cycles of the virus there will be, the less likelihood that there will be any kind of mutation, okay? But when you think about it, I want you to think about all the snivelly noses that you've gotten throughout your whole life, all the times you've gotten a cut and it looked a little red, whatever, you know, all the infections that you've ever heard about, okay? Just as likely for those to evolve and turn into something else as the coronavirus. The difference with the coronavirus is that it is worldwide, so obviously there is more of it. But even if something does change in the life cycle of it, it is more likely it will destroy whatever that new product is than turn into something horrible like an airborne variant. I cannot tell you for sure, but I can tell you that the more we just do the simple things that I said, stay calm and stay clean, the less likely any of this horrible science fiction stuff actually becomes science. All right, let's see. So Vicky's asking, so she started research in China and says they're using high-dose IV vitamin C. So again, this is just one of those things that they're trying. Vitamin C does have a role in fighting infections in your body. Simply put, taking and eating 95 oranges in a day will probably kill you because you probably ate 95 oranges in a day. Drinking water is a very good thing for us, but you can drown in it. Sunlight is good for us, but if we have too much of it, we get cancer. If you do too much of anything, it will be bad. If you do too little of something you need, that is also bad. All I can tell you right now is that we have zero actual confirmed evidence, right? And by which I mean not just one or two cases, but we have looked at various groups of people that we have treated differently, just like a scientific experiment. We've changed one variable here, one variable here, one variable here, and we see that this group is doing better. That's something we can hang our hat on. Anything else is an illusion made to make us feel better. And I wish I could tell you better, but that's just the way it is. Okay. Chad says that he works at Costco and will work out private deals. Perfect. Jessica says nobody seems to care about the cops. I personally am very thankful for the brave men and women that are keeping the rest of us safe. I think we should be aware of that. And I think that, you know, after all this is done, more should be done for them. I absolutely agree with that. Okay, so Joel says that liquor stores are considered essential in Wisconsin. I've been to Wisconsin. I'm going to agree with you there. Okay, so Candy's saying if I'm delaying my focus. So I have been taking care of friends and family, as you guys know. Unfortunately, I've had some losses recently. And I've been helping out. As of right now, I'm not actively back in the hospital. Honestly, what we need more than anything else are more resources, more vents. You know, that is one of the things that is very clutch and key in New York right now, that there's a stockpile of 20,000. We need more vents. But here in Atlanta, it's not necessarily a question of more feet on the ground. But if I'm called and if I'm needed, I will be there. All right, so Sam says he's got Guillain-Barré syndrome and he hasn't gotten a straight answer about what to expect. Hold on, am I going to do your 10 push-up challenge? Sam, when you're ready for me to do 10 push-up challenge, I will sadly do it. Meaning I will look horrible, but I will do it for you. Okay, and I wish you luck with it, man. All right, so Charles says he's working for a company that helps track fuel for flights, so he's still getting a paycheck. That's good. How long? All right. So Andrew's asking how long the virus lasts outside of the body, e.g., someone coughing. So if someone coughs, right? The idea is it's not something magical. The same way, like if you squirted a squirt bottle and in the sunlight, and you would see it goes up, and they slowly start to fall down. That's how long. That's the same thing. So as long as someone does this, right, right, then you're okay. I said this in the last one. If you have to cough or sneeze, don't do it into your hands. That's what you touch people with. That's what you touch surfaces with. Just, you're not a horrible person. You're not a pariah. It's winter. Everybody's coughing and sneezing. That does not mean you have the coronavirus. But again, in this heightened state, please just be aware. Everything. Okay. So Neil's asking, did you cover pregnant nurses on the front line? So anytime pregnancy is involved, I immediately am just like, whoa, let's do everything that we can for these people. I know in certain hospital systems, and you have to understand that hospitals are run by corporations, okay? So what Corporation A does not speak at all to what Corporation B does. You would think there'd be some sort of like just universal standard, but there is not, okay? So in some hospital systems, right, we know that the older you are, the higher risk you are. So they're asking doctors that are 60 and over not to do certain things and asking the ones that are 50 and younger to fill in. And that does make medical sense. I personally feel like the same thing should be done for someone that is pregnant, because obviously this is happening right now. We don't have any data as to what coronavirus or COVID will do to a pregnancy. So far, we have no evidence of any lateral transmission. And that's lateral transmission is a phrase that we use to say that it got to the mother and then it went to the baby. But this is very new. And the things that we know, right, are growing, but they are way too finite. So as far as that, I think that someone that's pregnant should probably talk to their boss and limit their exposure as much as humanly possible. Okay. So Jason's asking how long before a vaccine is going to be available. Honest answer is I don't know, and no one does. It's partially luck. It's partially how much money people are investing in it, and it's partially how much people will work together to share their data. I would hope that we will have an answer soon. But keep in mind, I want you to be very realistic. Let's say that we, somewhere in Sweden, said tomorrow that that we have it for everyone. We don't have enough gowns and masks for people right now. It's harder to make a vaccine and distribute it to everyone than it is to make a mask, okay? So we need to not hang our hopes that there's going to be some, big whatever. We need to do what we know will help. And that is staying calm, staying clean, wash your hands, social distance, okay? And help those that need it, i.e. our elderly and high risk, so that we can save as many lives as possible, right? So that when we're talking about this next year, we talk about how we rallied together rather than how we were just rats on a ship, okay? All right. So Zach's saying, how do I feel about the Korean COVID drive-through testing? I'm not knowledgeable enough to really speak on it. I think that there are certain potential yields to getting tested. But as of now, we have no cure and we have no vaccine. So even if you tested positive, if you can stay home, we're just going to say the same thing. Stay home. Okay. So Ed says that he's always washed his hands in between calls. And I think that's great. For the ladies in here, you may want to turn away. A lot of dudes do not wash their hands when they're on dates or just period. It's gross. Wash your hands, guys. Okay. All right, so I will answer one land-related question because this is awesome. Can Richter invent denim in land? Well, what is the point in being in the land if he can't? All right, so Sam, I think I answered your question before about Guillain-Barré syndrome. Guillain-Barré syndrome, as I recall, does make you more susceptible to illnesses depending, right, on how far it has progressed up. So what I would say there is, if you're asking doctors for a specific answer, it's probably because they don't have one to give you. Follow even more closely the recommendations that I'm putting out. Okay. Let's see. Jay says if it comes to freaking out, listen to the experts in the field. I agree. Listen to experts. That's why they're experts. Listen to scientists, listen to doctors. Follow what they are saying, not what anyone is promising. We have to go by the actual information we have, because the panic will cost more lives than what we're going through. Okay. All right, so Chris is asking, how do I feel about the VA hospital network being the federal government's emergency response network for pandemics? Because as a veteran, it worries me. All right, so the VA is a very sensitive topic in this country for anyone that knows. I will say we are lucky that the VA exists. We need to do better by our veterans, period. We need to update its systems, and we need to inject more money into looking at issues, not only dealing with corona, but PTSD, addiction, and the things that our fighting men and women have to deal with when they come back. We are lucky that it is there. I know the doctors there are heroes, because they, with a nickel when they need a dollar, they do everything they can for people, but we need to do better, period. Okay. So Brandon says, hi, Aleron, I don't know if you covered this yet, but what are your information about ibuprofen? Okay, so again, ibuprofen will reduce a fever, and it will reduce an ache and pain. There is zero definitive evidence that ibuprofen will fight COVID. There is mountains of evidence that if you take too much ibuprofen, you will destroy your kidneys and be required to go to dialysis for 3 hours, 3 times a week. Okay? Or that you will destroy the lining of your stomach and suffer from debilitating stomach cramps for the rest of your life. Okay? And result in more infections in your body. These medicines are amazing. We live in an amazing age of medicine that we can take pills that do a lot of great things. But none of them are without side effects. Drinking too much water causes medical issues. Okay? If you're going nuts with it. Drink a lot of water, guys. My point is that until we get the scientists and the doctors to say, we have done trials, this is the data that we have, and this is what we recommend. I know it's scary, but don't react. Don't panic. Stay calm and stay clean. Wash your hands. Social distancing. You will make it through this. Okay. So Daniel's asking why azithromycin isn't effective versus viruses, because it helps with bronchitis. So azithromycin is technically it's called a macrolide. It's the kind of medicine that it is. And what it does is it works with atypical infections. Without getting into the psychopharmacology of all of it, basically just realize that it can help against the things that go along with certain infections, but a lot of times bronchitis is caused by bacteria as well. Okay. All right. So Kevin says he's going to Cali hauling face masks. That will be very welcome by them. That's good that you're doing it, man. So Floyd is saying that people are saying that they have COVID with no fever and typical symptoms. That's entirely possible. If you are younger and you get COVID, right, coronavirus, you may not even notice, okay? You might just get a cold. Or it's winter and you could just have a cold, right? We can't know. But the point is, you need to just everyone needs to be doing the same thing. Stay away from other people for right now, okay? Let this crisis pass and let us help as much as we can by staying distant, okay? If you have a cold at home, you have a cold at home, no matter what's causing it. You're going to get better. If you're 13, you're going to get better in 3 days. If you're 40, you're going to be achy and irritated that you still a little bit have a cold, because that's what happens when you're 40 and you get a cold, okay? Either way, let's just try to watch out for each other, okay? Stay calm. Stay clean. All right. Let's see. All right, so Anthony's saying, should I take Tylenol or Advil if you're feeling sick? Does Advil carry greater risk? So all of these medications, again, every medication that has ever existed has potential side effects, but Advil and Tylenol are usually some of the safer ones as long as you're not taking it to excess. If you're taking it every day, that's a problem. Call your doctor, okay? If you take it every once in a while because you feel achy or you have a fever, that's okay, okay? That's how this works. Okay. And as Jeremy's saying, it's really tough to know the true status of an outbreak due to limited and inconsistent testing. That's absolutely true. Again, we would hope that everyone would put aside, personal biases and everything like that, but human beings are human beings. New York has 10 times as many cases as anywhere else, but New York is also testing way more than anyone else. I'm absolutely not denying that they have the cases, but how many cases are going undiagnosed other places? How many people are asymptomatic and we don't know? There's a lot of things we don't know. And that's true for life in general. It's just that right now we're facing something scary, so we're aware of our vulnerability more than we normally are, okay? Again, just do what you can do. Isolate yourself, wash your hands, be kind to each other. Okay. All right, I feel like I'm just repeating myself a bunch, so I'm gonna. Whoa, man, I missed. All right, so I'm gonna answer a couple more of these, and we will go with that. Okay. I will agree with Dan Lee. Remember, buying all the toilet paper does not prevent the virus. It just makes people use their hands, and that's horrible. And yeah, all right. So look, you guys, it's scary. That's why I wanted to hop on here. That's why I wanted to talk to you again. You will get through this. We will get through this as a society, okay? As of right now, again, I will repeat a couple things. COVID is not airborne as of everything that we know. There's been a couple things that may hint to it only in a laboratory setting where they control everything. As of right now, worldwide, right, we have no evidence that it is airborne. So if you wash your hands, right, if you stay away from other people, stay home as much as possible, and just be aware of your surroundings, right, then you have the best possible scenario of keeping you and your loved ones safe, okay? Now, with all that being said, if you want more technical stuff, my earlier talk is right beneath this, where I went into a bunch of technical stuff. I will let you know if we hear anything else definitive. Please just keep taking care of each other. We really can get through this. Please stay calm and stay clean. I miss all of you. I'm going to do something fun on Friday. I think I may read the first chapter of God's Eye to all of you, as long as my voice holds up. And yeah, so I will give you more updates. Nick is working on monsters, but he's having to take care of his family, and everything's slowing down too. I will give you updates on that soon. And it's God's Eye, again, will probably be coming out sometime in April, once I get everything set as well. You're appreciated. You're awesome. We're going to be doing a big charity giveaway all throughout the month of March, trying to help out the Miss Village as much as possible. And yeah, that's it. All right. So gnomes rule, as always, guys. You rule. Peace, love, Perfect Margarita.